that you need to know, or feeding tubes that we use for unconscious patients, helpless patients, or patients who are finding it difficult to swallow. I know, so most of you, the common one that most of you know is the NG tube, but no, we have different kind of tubes that we use for feeding of unconscious patients, helpless patients, or patients who are finding it difficult to swallow. So in this episode, we are going to talk about a whole lot of tubes that we use for feeding. Stick and stay with me and turn on your post notifications so that anytime I drop video on this channel, you'll be the first to watch. Guys, let's get into the video. The first tube that we are going to talk about is the nasogastric tube, which is known as the NG tube. When we talk of the NG tube is being used for patients who are finding it difficult to swallow, or patients who are unconscious and due to that cannot tolerate any food through the mouth, or cannot tolerate oral fluid or other things that will go through the mouth. This tube is inserted through the nose into the stomach. It is inserted through the nose into the stomach, and it is a short-term tube that's being used for some few days, or approximately for 6 weeks. So this is a short-term tube that we can use for the patient who is unconscious. The next one that we are going to talk about is the orogastric tube. When we talk of the orogastric tube, it's mostly known as the OG tube, and these tubes are being used for patients at the neonatal or intubated patients, case who are being intubated, and case at the neonatal unit with maybe some conditions when the kid or when the infant or the little one cannot breastfeed or cannot tolerate breastfeeding. That's when we pass the orogastric tube so that we can use that one to feed the neonate, feed them with some oral medications and other things. Then also, these tubes are being inserted through the mouth into the stomach. These tubes, known as the orogastric, they are being inserted through the mouth into the stomach of a unit. And the next one that we are also going to talk about is the nasoduodenal tube. When we talk of the nasoduodenal tube is being used for patients. It's being used for patients who are suffering from a severe or a high risk of aspiration. So when there's a high risk of aspiration or delayed gastric emptying, that's when we insert the nasoduodenal tube for the patient to help them. So mostly when the patient is suffering from, or they mostly give it to patients who has